Welcome back to Talk to Talk. I'm Maricel Laksa-Pangilinan with Dr. Oy Balburias.
Joining us now is Dr. Chito Salud. He's a laparoscopic and bariatric surgeon at the Medical City. Sir, welcome to the show.
Thank you very much.
You're a professor.
Yes.
Thank you very much for inviting me over.
Thank you for sharing with us your time. Doc, is bariatric surgery for anyone?
Well, bariatric surgery is basically for the severely obese individual, especially those with existing medical problems like diabetes, like hypertension. It's not for everyone. It's not for all obese individuals, in fact. There are strict guidelines that we follow.
So it doesn't mean that, for example, you've tried all kinds of diets na, tapos you've given up, mag-bariatric surgery ka na lang.
Well, it's actually the last resort when a patient needs to lose all that weight. There are weight management programs naman that can be availed of before the surgery is contemplated.
So what's the first step?
Well, evaluation first by our physicians is necessary. If we need to, we enroll them in a weight management program, especially those who are not that severely obese. So the weight management program involves exercise, diet, a special diet, and if necessary, medication. Only if these individuals fail through this program should we consider bariatric surgery.
So when a patient is to undergo bariatric surgery, what are the factors that you consider before going through the procedure itself?
Well, first of all, if the obesity has been there for many years, if the obesity is only very recent, chances are these individuals will be able to lose their weight non-surgically without surgery. So that's one factor, and there are other factors including the presence of other, I mentioned earlier, medical problems, diabetes, even sleep apnea, severe arthritic problems. These are all factors that should be considered when a patient is consulting for bariatric.
There are many, well, how do you call it, types of procedures that you consider when regarding bariatric surgery. Of course, like if I mention it, like sleeve gastrectomy.
Yes.
And in the case of Isabel, we used laparoscopic banding.
Yes.
Okay, so why was this considered for her?
Well, for one, Isabel's BMI, body mass index, it wasn't really that high. Secondly, she preferred the gastric band because it's the safest procedure as far as the bariatric procedures are concerned. There is less need for less risk rather as a result of the operation, and it's also technically the easiest procedure to perform among the different types of bariatric.
How did she prepare for this?
Well, like any other obese patient, we have them undergo a series of tests and clearances, which requires them to be seen by a number of specialists, including cardiologists, pulmonologists, and endocrinologists, even a gastroenterologist, and finally a psychiatrist, to make sure that these patients will be disciplined enough to lose the weight after the surgery, because some patients do not lose weight actually.
Okay.
So it's not a guarantee that they will lose all that weight.
So it's not as easy as like the before and after lang, no, Doc?
No, it's not. As a part of the preparation also involves that they undergo a dietary process for about a week or two, usually 2 weeks, to begin the weight loss process, as well as to make the procedure technically easier.
Okay.
And this diet will be necessary even after surgery. We normally advise them that they have to maintain a certain diet after the operation, and that they must change their lifestyle. There should be a drastic lifestyle change, which involves not only diet but also exercise.
Okay.
And the like.
Yung sa diet, yung portions of their food, kasi pag marami, there's a cost.
Yes, actually, if one of the requirements after the surgery is for patients to limit the amount of food or the volume of food that they are eating. They should chew very well. They should only and they should space the amount of food that they're eating. It shouldn't be large in volume. More likely, if they overeat, they will end up throwing up. So we advise them against this, so that it is necessary that they chew their food very well and choose the food that they eat. It should be sugar-free. It should be low caloric, and otherwise, they will not lose the weight.
Doc, these are the different bands that you use, diba? Which
Yes.
one is the band here?
That's
This
the
one?
band. That's the band we used on Isabel.
And then you adjust it. When do you know how and when to adjust it?
Okay. The band is, if you notice, it has a. This is what we wrap around the stomach.
Parang belt,
Okay.
no?
It's like a belt.
Mhm.
Okay. And then this tube is attached to a port.
A port.
One over there.
This one?
This one,
This
this
one?
one.
Yes.
Okay.
And this one is buried under the skin.
Dito.
Okay, under the skin. So how do we adjust it? We inject through the skin. We inject this port.
Okay.
We can inject saline to inflate, or remove the saline to deflate. The initial adjustment, or the initial inflation will usually be done on the 6th week after the surgery, and then we adjust it every 1 to 2 months, depending if the patient is losing weight or not.
Oh, so the point is you want to
Tighten.
tighten it so that there's less food in the stomach.
So less food can enter.
And then you will not gain weight.
Right.
Because the more food there is in the stomach, the more you gain weight.
Yes.
Do you eventually remove that?
No, we can leave it there permanently.
For life?
Yes, yes. In fact, we encourage patient not to have it removed, because removing it will require another operation. And if we remove it, there is a chance that the patients will regain the weight again.
No.
We only remove it if there are risks or problems associated with the operation. So that's the
So
only
just
time.
in
we remove
case,
it.
halimbawa, nandyan na yun, pero they don't change their eating habits. Mahirap naman to maintain that. Will it burst?
There are risks of leakage. Bursting is not likely to occur, but it can move around, and that's one of the risks or complications of the procedure. And in fact, one of the reasons why the band must be removed.
Okay.
But in general, we leave the band in place permanently, and we encourage it to be left there.
But that's just one of the procedures. There are other options.
Yes, there are.
And what are they?
There is also what we call as mentioned earlier, the sleeve gastrectomy, wherein the stomach, 75 to 85% of the stomach is removed. You create a banana-shaped stomach. The advantage of that is there is no foreign body
Yes.
present in the body.
Napapatak-in tuloy ako kasi ayoko na malaki.
The stomach is significantly reduced in volume. So again, the patient can only eat so much.
But it's more permanent.
That is also
It's permanent.
irreversible.
Irreversible.
Unlike the band which is reversible, wherein you can actually remove the band, as I mentioned earlier, if the patient wants. You remove the band, the anatomy and the absorptive capacity of the stomach remains normal. In the sleeve gastrectomy, once you remove the stomach, that's it. You cannot return it back.
How do you choose which, like sleeve gastrectomy, lap banding? Like, how do you determine? Is there a factor?
Well,
on
preferably-
patient factor or?
Yeah. Preferably, we use the sleeve gastrectomy for bigger individuals,
Okay.
for those with a higher body mass index, and especially those who refuse to have a foreign body in their within. We use the sleeve gastrectomy, but it's technically more difficult to perform. There is a higher risk related to the surgery for the gastrectomy as of compared to the banding.
The BMI is, I think, 77 or
Yes.
76, if I'm not mistaken. So, which would be more appropriate for this individual?
The sleeve gastrectomy would be better for
Better.
that type of patient.
You can also do it laparoscopically.
Yes, we can
Okay.
also. Although we can also do on those patients, those really huge patients may require also a gastric bypass, which is another form of bariatric surgery. It's the technically most difficult
Procedure.
operation to perform of the 3 types. There are higher risks involved, but the weight loss is faster with that type, the gastric
Ako the
bypass.
faster, the scarier. Kaya mas maganda pa yung gradual. Doc, meron bang mga ibang health conditions na hindi talaga pwede for bariatric surgery?
Well, for those with really severe medical problems like severe cardiac problems or severe pulmonary problems, wherein the surgery alone may be difficult or be very at risk for these patients, we don't suggest that they undergo bariatric surgery yet. Also, there are patients who are at the extremes of age. So in the young and the very old, bariatric surgery is not recommended. Those with thyroid problems, for example, the hypothyroidism, this could be the source of the obesity. So maybe it's best that these patients be treated for their thyroid problems first to find out if that is really the
Root cause.
The cause, yes. And so that bariatric surgery may not necessarily be needed for this patient.
There's still more to discuss about bariatric surgery, but we have to take a break right now.
When we come back, Dr. Salud will answer the questions of our audience here in the studio and those sent by our televiewers via email. Stay with us. Talk to Doc will be right back.